Hi, I'm Tim Campos, Director of Recruitment Programs and Outreach in the Admissions Office at ArtCenter College of Design. Welcome. Today I'm going to start hosting a series over the next couple weeks that really focuses on connecting with leaders within the ArtCenter community to inform our campus community about the upcoming reopening of campus and the safety protocols and measures in place and what that means for anyone either returning to campus as a returning student or our new incoming students as well. And so we're all experiencing various aspects of the pandemic, and we wanted to make sure that you have the most relevant information as you're getting ready for the start of the fall term at ArtCenter, whether it's joining us in person or remotely as well. And so today's conversation is going to focus specifically with our Vice President for Facilities and Campus Planning, Rollin Homer, and we'll continue to cover a variety of questions that have already come in and incorporate that into informing everyone what our protocols and safety measures are regarding our physical spaces of promoting safe learning and making. And so I'm going to briefly in just a moment invite our Vice President for Campus Planning, Rollin Homer. Just give me 1 second and he'll join us. And also, a friendly reminder, if you have any questions that come up during our live stream, please feel free to ask questions and we will get to those questions towards the end. So, Rollin, how are you?
Good. How are you doing, Tim?
Great. So maybe you can start by sharing with us a little bit about yourself, your role in the ArtCenter's community as our Vice President for Facilities and Campus Planning.
Great. So I've been at the school since 2003, so just a little bit over 17 years. Done everything from being a designer in the architecture department now to leading facilities and campus planning, which also includes auxiliary services, so food service, shuttles, and so on and so forth. During the COVID months, myself, along with other key staff members, have been leading an effort, and mostly that is Cynthia Quinton and Jim Finch from security. Cynthia Quinton, who is our Director of Environmental Health and Safety, for those that aren't familiar with her. And then with a whole slew of others, and there's too many to name out there, but again, all of you are recognized, and I really do appreciate all the help that went in to get us to this point. And we do have a lot of heavy lifting to do, and that's the purpose of these, which is to make sure that everybody knows what to expect, and also to really come together as a community to say, hey, this is what we're expecting from each other. This is our commitment to each other to be, in a safe environment, and that it takes all of us to get there.
Right. No, and I'm curious. Obviously, we're all impacted by this differently. How has COVID-19 and the pandemic influenced the way you're operating and making sure that we're opening up a safe space on campus for those who are choosing the in-person option?
Yeah, thank you. I'll say, from the very beginning of the planning, when we even contemplating shutting down in March, again, my departments, Jim's departments, and others, we're the departments that have to stay on campus. So we've been on campus since March. And so all of our planning has really been predicated on making sure that people that have to come to campus, whether it's security, facilities, janitorial, that one, they go home each day is safe. We really want to make sure that people working on campus, don't catch this on campus and can continue to support us all. That being said, we've also done our planning with the assumption, all of our planning has been with the assumption we will have a case on campus. And so when you put that mindset in there, that it is not about preventing a case, it is about how do you not only prevent them, but also how do you deal with having a case. And so I think where that kind of thinking and in that kind of lens really has come personally into effect is probably within the past 6 weeks. As there's been spikes across the country, in locally, I have family that's spread out across the country. I've had, my wife's brother who had to go into quarantine because of close contact. I've had a brother-in-law who spent several weeks in between urgent care and ER, who lives at home with my elderly parents and their kids and so on. And then my wife's cousin actually had spent 3 weeks in the ER with pneumonia and COVID. She was able to go home just over a week ago, but still uses oxygen. So, you know, while those are unfortunate, I also know staff members that have personally lost family members. So, you know, we take this very seriously, and our process and our thinking is really getting down to, we don't want anyone to get sick. We don't want to help spread this virus. And the planning we're putting into effect is the institutional responsibility. I say that, meaning we have to create the conditions to allow anybody that's going to participate in those conditions to be able to understand how to be there safely. It's the personal responsibility that we want to make sure everybody understands, right? Just because we can say we can be on campus, we really need everyone to participate in that, regardless of what you believe the pandemic is about or not. So we know there are community members who would come to campus today with no safety protocols in place, no mask, anything. We also know we have staff members who literally, or not just staff, community members, if you will, that literally have not left their apartments or homes since March. So we have this wide range of community that we have to think about. And we want to make sure that anybody that comes to campus, if you're a faculty member, staff member, a student, a vendor, a contractor, we all have a role to play. And we want to make sure that that message gets out there and that everybody understands what their role in it is. Because we can only do this collectively together.
Exactly. And so as you're kind of, talking about some of the things that informed your decisions, maybe you could walk us through a little bit of what that looks like in terms of as you're getting ready. And I know some of it's going to continue as we get into the next couple of weeks, but kind of what that process looks like for getting campus physically ready for some of those spaces, the maker spaces and learning spaces.
Yeah, so the process really was, okay, we had to sit down and with education and really scrub the schedule. Or the schedule of classes, right? Which classes could not be done online? So basically, what are the ones that were key to the facilities on campus? And we had to identify those. And then we went through a whole scheduling process with everyone where we had to look at, okay, how many people can be in which room? So we socially mapped out all the buildings, all the classrooms, all the offices. We then overlaid that with the schedule, said, here's how many classes we can support. Here's how they would work in time and in space. And then what we've been doing in tandem with that kind of planning was looking at the facilities as a whole. So there was two key partnerships that we brought on really early in this. One, we brought on an industrial hygienist, and this was somebody that came in very specifically to look at the facilities as a whole. So what does our mechanical systems look like? What is all the things that operate the buildings look like? And are they at peak performance? Do we need to make enhancements? And then we also brought in an infectious control specialist. Now, this is somebody that all of you will be meeting at some point through some training. That'll be part of coming back to campus. But this person, their role was to look at the plans we have in place, to look at how our buildings operate, and essentially give us an indication of how well are we prepared to be able to have somebody come back to campus besides the essential staff. So if you take all that into consideration and then you fast forward and say, okay, what do we have left to do? We have a lot left to do. We're at the point of, okay, getting the we're also looking at, again, what other improvements can we do to the whole process of mechanical. We've upgraded the filters to the best we could on the mechanical systems that are MERV 13. You can look that up to see its level of quality. We're increasing outside air exchanges. And more importantly, what we should note is on, all of our buildings, 870, 950, and 1111 have been going under transformations in the past 6 years, predominantly on systems and classroom spaces. So those buildings have newer mechanical systems. Elwood, not as much. So a project that we had been working on and was scheduled for this summer, we sped up to make sure it got done this summer, was looking at mechanical systems for Elwood and putting new systems in place. So we're about just over a third through that project. It'll be done in phases, but we'll have a whole major section of the building done for this fall term. And then in other areas, such as like the shop areas and areas we didn't get to, we're increasing air exchanges and filter changes and so on and so forth. So it might be a little bit warmer in the building, but just know with the heat comes a lot more fresh air.
And so with all that in mind, what would you say is one of the for students, incoming students, either returning or new students, what would be one of the biggest difference they should expect in terms of accessing and navigating either Hillside or South Campus? Like what are some of those protocols? You're a student, you're coming September 12th, first day of class for those who have classes on that day. What is it going to look like in terms of accessing either Hillside or South Campus?
Yeah. So the big thing here is to plan ahead. One, I say this to students and to faculty and everybody else, which is to say the first week, the first time you come to campus, expect it to be a little bit slow. We're going to be processing people as fast as we can and as efficiently as we can. However, if somebody arrives at class a few minutes late, give them a little bit of break. We're all in this together, figuring this out. But let me walk you through sort of what we anticipate to be rolled out as the basic level of how to come to campus. And it really starts at home. So we're going to be introducing an app with a company that we're working with right now, which will be the screening process. So basically a series of questions. How do you feel? Have you been sick? Have you been in contact with someone with COVID? Have you traveled? All those questions that are currently out there in our current access form. From those lists of questions and from your home, you'll basically be given an indication whether to come to campus or not. So if you answer something in the screening process that says maybe you should stay home, it'll tell you right then, even before you walk out the door. So that's step number one, is that can be done daily. We'll be rolling that out here in probably week 2 of the break, I would suspect. So people can see it, ask questions, and play with it a little bit. The next step is, let's say you get the indication that says you can come to campus. So I'll use Hillside as one example, and then talk slightly about the differences at South. So let's say you come to Hillside for your class. The first thing you're going to do is you're going to be stopped at the gate, and you'll show your ID badge. We're not allowing any public visitors on campus. So only students, faculty, staff, and vendors or contractors that were pre-approved to be on campus will be allowed.
And of the staff and faculty, those that are considered essential, right?
Correct. Yeah. We're not bringing back administration. Unless you need to be there physically to support the classes on campus that day, we're not allowing you to come on campus. So it is very controlled. We've cut the occupancy of each building below 1/3 of its normal occupancy as a topping. But through the scheduling, we're anticipating operating those buildings at probably 1/8 of their normal capacity. So, if enrollment hits the peak that we see on the scheduled classes, we might have, I think our peak day was like Wednesday morning, and there might be 100 people in the building at Elwood Wednesday morning. Otherwise, our numbers, if we hit the maximum enrollment in the classes, we're seeing the average number of students on campus at Elwood is probably in the 50 to 65 range. So, that's down from 1,000 people, in the building that you're typically probably used to, So again, very low numbers of people on campus. But that first experience to get there is, we're going to stop you at the gate, you show your ID, we're actually going to count you at that moment. So we're going to limit the number of people on the Hillside campus to a total number. Anybody coming in will be counted towards that number, regardless if you go in the building. From there, you'll park in the student lot. Everybody's going to park in the student lot. Check-in will be at the student pavilion. So you'll go in, the app that said you could come to campus will give you a little QR code that you scan. That scan will tell security if you can be there or not. Once you've scanned in and security gets the thumbs up, then basically you'll be given a daily badge to wear. And the idea of that is making sure that we have something visual that we know you went through check-in. Right. From that, you walk down to the building, you'll scan your ID badge to go in the doors, and then you can go into class. The scanning of the ID badge at the door, that's important for us to start and look at contact tracing. So at a bare minimum, that process is probably what you're going to experience at South Campus, or I'm sorry, at Hillside Campus. South Campus, it will be all the same except the parking lots are open. So basically, you won't be stopped at the parking lot. You'll park, and then you'll go to the front door of each building. There'll be one entry at every building. So 1111, it's going to be the lobby. At 950, it'll be that front lobby at the south end of the building. And then at 870, the same thing in the front doors. So once you check in, though, if that's our baseline, which is you do the self check-in at home, you come to campus, we know you're in the building. Okay, that's baseline. What we're trying to implement, and this has more to do with contact tracing after, is being able to issue those that come to campus some sort of RFID tag or a Bluetooth tag that we can track in the building. And it's important because if we only scan you at the front door coming into the building and you come back to us later and say, I might be a potential case or I actually do have the virus and we need to notify who you were around, if you're working in an open fabrication room, you might not know the people you are around. So therefore, we have to look at everybody that walked through the door and say, are they a potential case now? So if we can get to the point, which we think we can, with a few companies we're talking to, you might get like an RFID bracelet and it would ping every so often in the building. And then that would help us narrow down potentially in that sense of contact tracing. And I do want to point out here on both of those applications, we're approaching this from strict privacy controls, which is to say it's third party, it's HIPAA compliant. We have no access to the individual information being collected. It is only going to be used down to that level in the need of contact tracing. And it won't be stored past, right now we're trying to see if that's a 45-day period or a 90-day period. So we're being very sensitive on that side, but we do need something in place so that we can keep the buildings open throughout this period of time.
And I'm sure, obviously I understand, but just to clarify for our viewers, even if a student maybe necessarily isn't on campus specifically for a studio, a course, but they're accessing campus for one of the model shops or the print shop, anything of that sort, they're going to still, anyone who's actually entering campus, whether it's to utilize a facility or attend class, they're going to be following the same exact protocols that you just outlined.
Everybody, anybody that we let through the door, regardless of where you fit in the affiliation with the school, goes through this. So contractors, vendors, suppliers, students, faculty, staff, everybody's going to go through it. It's the only means that we have to do contact tracing, to make sure we know who's in the building and be able to make sure that we can maintain the school as safe as we can throughout this period of time.
So on the topic of some of the our amazing fabrication shops, model shops, all the different maker spaces, what are some additional adjustments that have had to be made at either Hillside or South Campus for those particular spaces to accommodate students and of course limit the amount of students accessing those spaces at any given time?
Right. Yeah, so let me start with the big macro lens here. We're offering really two types of experience on campus this fall, right? There's going to be what we call service bureau options. Those will be things like copy center, library, some of the shop facilities, rapid prototyping, EMEC, photo. These will be things that basically, if you haven't already done it this summer, you might experience this fall, but basically, hey, I need to get something done. I can send it to you digitally or somehow transfer it digitally. We'll make it for you, put it in a location for you to be able to pick it up, and then you come to campus, pick it up, and take it away. Or in some of those instances, even potentially shipping it to you. So all the typical resources, we figured out a plan on how to either offer them as a service bureau or what they look like in person. So we will have an open computer labs for both Mac and PCs. They'll be on various campuses, so we'll make sure that's detailed. People know how to find it. We do have open fabrication areas, so for the shops, so on. So one of the big differences I'll talk about the shop in that example is most people used to be able to go into the shop. You'd open the door, you'd go in, you'd find an empty place on one of the tables there. You work at that table, you do your cutting, so on and so forth, right? We've moved out of the shop proper the space where you would normally put your project together, the fabrication area. So basically the idea is to be able to cycle people through the tools in a manner that allows anyone that needs access to them without limiting the number of people that could be in there and to only a few, right? Because we know the room can only hold a certain number of people. And if you're making in there and cutting and doing all that work, that means there's going to be a big line of people who can't get in. So we're looking at basically how do we set up rooms adjacent to the shops for you to make in, and then go and do the cutting or the work that has to be done on your materials, but assemble or fabricate in another area. We're looking at a queuing system to go with that. So some way to potentially use an app that, the digital meat counter line, like you get a number and it tells you when you're ready or when you're next or so on. So we're trying to figure out a way to do that without having people line up in the halls. Right. But we're making those final plans right now. We're working with the shops directly. Staying on the shops, I'll talk a little bit about the South Campus shops. So South Campus shop might work a little bit like they might be having 2 days a week where they only work on service bureau items that come out of that campus. And then they'll have 1 day for demos and then 2 days for open shop areas and so on. So each area will have a very specific plan on the number of people that can come into the space, how it works, how you get access to it. And we're going to have those outlined ahead of term. So this is the components of the website that we mentioned in the emails and so on. This is the information we're going to put on the websites. And it'll be updated over the next 4 to 5 weeks before we get to the opening of the school. And Photo has a plan. Archetype Press has a plan. Every space on campus, we have a plan, not only to how do we help you get your work done, but also how to, again, clean materials, clean equipment, check out equipment, very detailed.
And so, we talked about some of the facilities, but I'm curious also, and I'm sure some of our viewers are, if I'm in let's talk like a classroom, a studio space, I'm in a space, what are some of the implications or the measures that you utilize in terms of making sure that there's proper distancing within a space? I know that's been on everyone's topic, and how are we going to manage that within an actual classroom?
Yeah, and again, I'll put this in a context of, again, it's institutional responsibility and personal responsibility, right? And so the institutional responsibility in this is that when you walk into a room, let's say into a classroom, the desk will be socially distanced. They will have, in some of the rooms, they will have the barriers because they're needed based on the space requirement. There'll be tape on the floor to tell you where the table is. There'll be tape on the floor that says, hey, keep your stool or chair in this area.
Within that space, yeah.
Exactly, right? And so that's our responsibility, is to map all that out so that you guys know when you come into class, hey, this is what we're asking you to do. And then it's your responsibility to follow those, right? We are doing a couple of things in the classroom that are part of that, which is to say, we're setting up the classrooms so that the class, even though it's an on-campus class, that the class can be broadcasted out. And I say that because let's say if you're a student and you have to go into quarantine because of a close contact and you can't make the next 2 class sessions in person, we want to make sure that you can still be in class with your instructor, with your faculty, or with the other students, and basically still attend. So that will be something new. You'll see a bunch more AV equipment in the rooms. We're also meeting with each department to talk about, well, how do you do crits? How do you do discussions? Part of that AV equipment will be capturing the desks or the tables the faculty are using, right? So if I'm doing a demo in front of my class, I don't usually come up around the table. That's going to be projected on the screen because we're going to have cameras doing that. So really expect to see, again, it's not going to be normal. It's going to be this hybrid experience of being in person with a link to the outside, a link to the TV in front of you, so on. It'll be interesting, but again, it's all designed to make sure that we all understand our personal responsibilities in keeping it safe. And that goes with also, again, the basics. Wash your hands, social distance, wear your mask. we're going to have maps for you. Where's the hand sanitizer stations? Where's the hand sink stations? So on and so forth. I will also say, I'm going to pivot just a second, bring what you need to be on campus with you. We are opening micro market and vending. It's not going to be like it was before. So if you need food, if you need something like that, bring it with you. Water fountains by county health department regulations, we can't have operational. We're installing bottle filling stations. We will keep a small stock of emergency sort of supplies. So again, if we get it, you're going to forget something. You're going to forget your water bottle and just say, you know what, we can't have you in a classroom for 5 hours with no water. So,
Right.
you know, if you forgot it, hey, we'll find a way to get you a bottle of water. Masks, same thing. We had two alums. One alum donated 20,000 masks for
Wow.
students, specifically for students, and another donated another couple of thousand. So we're working out the details of how to get those out to students, how we issue them. But again, if you come to campus and you realize, oh my gosh, I actually left my mask, there will be areas where we'll be able to say, okay, here's a mask for the day or so on. So
Great.
I've done it. I've gotten out of the car and had to walk back, and been like, oh yeah, my mask.
I think we've all had that
Right.
come up.
Right. But that just shows you we're all human dealing with this new kind of reality that we're going through right now. And we're trying to make sure that, if you're coming to campus, we want you to know it's okay to ask for something, because again, we're doing the best we can. We're also human. This whole thing works if we have input from you, right? Because not all of us are going to be right there with you in your experience, right? So if you come to campus
Right.
and you say, hey, I'm experiencing this thing, is there a better way to do it? Send us those recommendations. Ask those questions. We need those things, because that's the only way we improve it. Don't assume that we know what's happening with you on campus, right?
Right.
We need you to be vocal. We need you to get a hold of us, and we'll make sure that all of that information is accessible.
So I'm going to wrap up right now and take a couple
Yeah.
questions, but there's just two pieces. One was bathrooms, and then also maybe just talk about cleaning frequencies. We already talked about the spaces and whatnot, which you have outlined there, but just the frequency of cleaning those spaces, and then also what does bathroom access look like?
So for the bathrooms, we're going to ask you to hold it for as long as you can on campus. No, we'll have full access to bathrooms. And so one of the things you might notice in the bathrooms is a good example will be sinks. Not every sink will be open. So we'll make sure to turn the faucets off to social distance in the bathroom itself. So if you go in there and somebody's using this sink, 2 sinks down will be the next operating one. But we'll make sure those are clearly marked, that sort of thing. Cleaning, I want to touch on this in a broader context. In January, we implemented a new cleaning regimen that started back when this even started to become a thing, right?
Right.
We brought on extra staff. We were wiping down door handles. We were wiping down, deep cleaning at night, so on and so forth. So that we're continuing to do. We're going to be aligning cleaning schedule to class schedule. So we already know where classes are going to be held. We're going to have a frequency of when we do and go through and repeat cleaning in certain areas, but it will be more frequent and it will be enhanced. Part of the benefit of using potentially an RFID tracking system is we can get anonymous data out of that for building cleaning. So the idea that might tell us, hey, you had 200 people walk down this hallway, but nobody walked down this one. Well, guess what? That tells us go clean that hallway, So we are trying to use the tools we have to help, make cleaning efficient, but also tell us when we need to clean. And even if that isn't installed day one, we do have an enhanced cleaning schedule. The key thing is also to think about in the scheduling of classes, we've limited campus access from 7 a.m. to 8 p.m. And it's very specific to allow us to clean at night to make sure we thoroughly go through the building. And in addition, we've limited, we worked with education to try to limit the back-to-back classes in any given room. So we've left at a minimum a 1 hour period between room usage. So if there's a morning class in a room and a class in the afternoon that follows 1 hour later, that's the first room we're going to clean. If there's a morning class and no afternoon class, that's the second room we'll clean, and so on. So we are going to be going through between classes, wiping down tables, wiping down chairs, wiping down any barriers that are in place. And we'll have, again, all of this, we've been discussing it for months, and this is bringing everybody into all those little details. And we really want to engage and make sure you have all your questions answered, or at least that you can allow or ask them so we know what to answer. And the plan is, again, we're writing this stuff as fast as we can. We're getting it up to the website. The website's going to be the big repository of information.
Right, and so in some of the information, folks would already have an opportunity to read through on our website. So if you go to artcenter.edu on our main home landing page, you'll see a tile box there that has information on some of those pieces, correct?
Yes, and I should say that's the big umbrella of reopening, right? And what we've got to get down into and communicate is all those little details, like, how many sinks are working in each restroom, where are the hand sanitizer stations. And I just know that we've been working on those. We're finalizing how to communicate that out. And in the next few weeks, those details will start to appear on that website.
Awesome. So I'm going to go through the questions here. I know we're having some questions come in, so I'm just going to scroll through here and see what we have coming up. Let's see. And again, if we didn't get to everyone's question, we understand it's a lot of information and then details. But as Rollin mentioned, there's going to be you're going to be able to access that soon. Let's see here. Give me a second as I'm scrolling through. Got a lot of hellos and waves, so hello to everyone.
Hello. While you're looking, I'm just saying, looking at my screen, this is the smallest I've looked in years. I look. And while you're looking, I just want to reemphasize, whether you're coming to campus or not, we are the group, the age group holistically that is really 18 to 49. If you look at the numbers, we're the group right now that's controlling basically the reopening of the economy, the reopening of the world. We're the group that's the most highly infected. And if we all can come together and basically show our strength, that basically says, hey, look, we're willing to wear the mask, we're willing to wash our hands, we're willing to do those basic things that allows all of this to be able to be opened up in some version, that's power. And we are the ones that have that power at this moment. And we should be doing what we can to make sure that we're voicing our power and showing our power, and really making sure that, hey, collectively, if I come to campus or not, I'm going to do my part for the betterment of the whole. So please, stay safe. If you're not coming to campus, stay safe. If you are, we're very excited to be able to do this, but we want to make sure that we all do it safely.
No, I couldn't agree more. And let's see, we didn't have too many questions. There were some questions on visa-related questions and whatnot. I would encourage you, whether you're a returning student, to contact, to connect with us. But if you're an incoming new student, you could always email at admissions. I know there were some questions about if you can study on campus. But there was a relevant question that came in and said, if you're a student on campus, you go through the screening process, but then you leave campus, maybe you, in between class, you go off to grab lunch or whatever it may be. Do you go through the screening process again?
Yeah, we're having full discussions around that. And the key part of that is, and I saw something roll up about temperature checks, we are looking at to see if we do thermal scanning. And I'll use that as the example to answer that question, which is to say, you could be asymptomatic. You could show up in the morning with no temperature at all, right? And maybe by the end of your class, you're feeling a little flustered or hot, and you go to lunch, and all of a sudden you come back to campus and you now have a temperature. If we're doing thermal scanning, we would ask you at least to walk through that barrier, and it would read your temperature again. So I don't have the full answer to what the process will look like if you leave campus and come back, but I do know this, that if you leave the building, we're asking you to scan your ID, or when you leave campus, scan your ID out, so that we know that you've left the building. But it's a great question, and we are discussing it, so I'll have more on that later.
And then just one more question, and maybe this is for another session too, but in the event that, a couple weeks into the term, it's identified that a classmate tested positive for COVID-19, what happens to the rest of the group of students who attended class with that particular individual? And kind of what does that look like?
Yeah, and I'll give a really high overview of this, but I know Cynthia is going to be you're going to interview Cynthia here
Right.
in a couple of weeks, and she can go into great detail about this and is the best one to really answer these types of things. But essentially, if we have either a case or a close contact, once all contact tracing will go through the health department and through Cynthia. That's her role. So the point of contact, and I can't say it enough, is the point of contact if you think you might been exposed, if you think you're sick or you are, it starts with Cynthia Quinton. Her role is to get us through those moments. And so she'll do an interview with the person that's suspected or so on. We'll do the verbal contact tracing. Where were you? Who were you with? If we have in place the interior building tracking, she'll work with the company to go through and say, okay, this person was in these locations. Let's look at the length of time they were in those locations and who were they in contact with for those periods of time. We know, if you walk by somebody in the hall, that's not enough time to be exposed in order to get it. If you're in a room together for 15 minutes, then we start to raise concern. If you're closer than 10 to 15 minutes within 6 feet of each other, we're really concerned, and that is definitely a moment that we want to know about, and we're going to definitely put you on a quarantine list there. But the process will be basically she'll go through and narrow down who we need to talk to, and then she'll have individual conversations with each person within that cluster to be able to say, hey, there might be a potential here. We would like you to isolate until we can confirm the case, and or until we get through a full quarantine. And I say that, we have had these instances over the past couple of months on campus. Not even a couple of months, I would say really in the past 6 weeks or so. We've been really conservative on the approach, meaning there are CDC guidelines that define close contact, and we've been really overly conservative on making sure that we go a little bit beyond that and make sure that there isn't any cases. But again, the idea is we need to figure out who you are, figure out if you're a potential for isolation or quarantine, and then make sure, one, you don't get it, make sure you've gotten tests, things like that. Make sure you can stay quarantined healthily, and then that you can continue your classes remotely during that period of time. But she'll be the person to really dive into that.
Yeah, and so if anyone has any more questions, either post this, we didn't get to a question. Again, we'll be hosting these every Thursday for the next couple of weeks. And Cynthia Quinton, our Director of Environmental Health and Safety, she'll be joining me in a few weeks, and we'll talk a little bit more in depth about her role. And, she's really up to speed and privy to local, county, and state health guidelines as well that really is informing our decision making, as well, as Rollin had mentioned. So again, we're running out of time here, but I want to really thank Rollin, our Vice President for Facilities and Campus Planning. I know it's not an easy task that you and your team have taken on over the last, not only the summer term, basically since day one, since we all went into quarantine, and kind of thinking about the long term and what that looks like. And so I just want to share with our returning and our new students, when safe, we want everyone to be back to campus, obviously. And so at the moment, this is what we have outlined, and it's no easy undertaking. So again, thank you, Rollin, for the detailed information. But if there's any other questions that come up, you could always email EHS, Environmental Health and Safety, ehs@artcenter.edu. And so we'll be taking a look at that and get to some of those questions in the weeks to come. I do want to put in a quick plug. Next week's interview will be, our Q&A will be with our provost, Karen Hoffman, and she'll be talking more specifically about curriculum and academics and some of the changes there, and what's going on with our curriculum and the academics across ArtCenter's community. And so I encourage you to join me again this time next week, 12 p.m. Pacific Standard Time, and we'll be talking with our provost, Karen Hoffman. Once again, Tim Campos, Director of Recruitment Programs and Outreach and Admissions here at ArtCenter, and thank you, Rollin Hammer, our Vice President for campus plan or facilities and campus planning.
Great, thank you. It was great to be on here, and I know you all have lots of questions. Please send them in. It is a process, and we're trying to get those answered as quickly as we can. So, yeah, thank you for stopping in and just hearing this part of the conversation.
Thank you, everyone. We look forward to welcome you either remotely or in person in the coming weeks. Stay safe. Be well.
All right. Bye.
Bye-bye.